Hi, I'm Dr. Bertalan Mescu, the medical futurist. The last time we talked about how and when the COVID-19 pandemic will end, and today I want to take it a step further and explore how life will change after we get through these trying times. Tag along. Life will never be the same. Crises happen to push us on another path. We have been having an enormous and blind trust towards the globalized world. This will simply change after billions of people are under lockdown for weeks. We will not be able to travel debt-freely or enjoy the supply chains of the world so easily. So sustainability, solidarity and healthcare will finally take center stage. There will be changes at every level of our lives. Maybe we should forget about handshakes forever. Maybe we will see people wearing masks everywhere, and we will unintentionally keep our distance and be more cautious around our elderly. New habits will arise, from properly washing our hands to a better overall hygiene and to entirely new travel habits. First of all, it's possible that while Europe starts to recover, the US will still yet to reach the peak. The devastation of COVID-19 will vary from country to country, so our globalized world will remain closed down and we could become potential dangers when we travel to a foreign country. Airlines are fighting for survival, as they are expected to lose almost $350 billion this year, so cheap air travel will not be back anytime soon. But if the pandemic goes down on one of the worst scenarios, we will have to accept that our travel routines will change on an individual level too. It will be the same when we had to accept airport security checks after 9/11. Only this time around, what if we would have to carry immunity passports to visit countries? I know immunity passport has an interesting ring to it, but it's a very simple concept. Patients who have been infected with COVID-19 produce antibodies specific to the virus, and there are tests in development that can detect them. These tests would show who has already been sick, regardless of having had symptoms or not, and therefore who is probably immune enough to the virus to safely move around. Of course, this will only be required if the pandemic goes on for many months, even with current lockdown protocols. Then, we would face an interesting world where a positive antibody test and a negative virus test would be a privilege that allows people to reduce social distancing and travel again. Just a few days ago, Dubai-based airline Emirates has begun carrying out COVID-19 blood tests on passengers at the airport prior to flights. This all leads to how our trust in the opportunities presented by the globalized world will be diminished. Seeing how virus can bring the entire world to the brink of collapse will surely take a toll on how we approach it. Perhaps it's the optimist in me, but as we realize that our modern world should not be taken for granted, we may finally understand that issues that seem far away can easily start a domino effect and decimate our lives. The way one guy eating an undercooked bat can lead to toilet paper shortage in our local store, we might finally realize how fossil fuel emissions will make the planet inhabitable given enough time. After all, if we are tired of lockdowns, just recognize this. In most countries, technically we can still go outside, it's just risky. But if we let climate change get out of control in a few decades, isolation will be the way of life. Not because it's risky to step outside, but because of air pollution, high temperatures and extreme weather, it will be outright dangerous. Or there will be no home to go back to. Self-isolation and lockdowns have already changed how we approach our jobs, and the impact will be long-lasting. Entire schools are online, along with companies living their daily lives on Zoom, and millions of people having business meetings with no pants on. Have you ever had a keynote like that? Someone has. Companies are forced to take novel approaches on how to keep things running, and after we get through this, they will have tons of information on how successful home office solutions are. We will finally learn how many meetings could have been just an email. We will definitely see a rise in remote working, even after it won't be necessary. The office space is here to stay, but perhaps companies will test the waters of 3 to 4 day work weeks, the way some Scandinavian companies already do, giving more time to employees at home. Our reliance on home delivery will stay with us long after the pandemic ends too. Even if a vaccine makes COVID-19 obsolete, how we approach simple things like going to the shop will change forever. We will try to keep limiting our exposure to risks, and especially if we work from home, contactless home delivery will remain the way to do it, simply because it's safer and easier, and all that will lead to more automation. If this pandemic teaches us anything, it's that our lives, as it used to be, is not sustainable for our planet. Now we all have to experiment with digital solutions. It simply makes sense to make digital anything that's not more efficient in real life, and to turn to AI to make supply chains and frankly entire industries more efficient. For example, I'm fully expecting AI to finally take a larger role in healthcare to make it more efficient. We have been talking about this for over a decade, but maybe this pandemic helped the message reach people's minds. Healthcare desperately needs an upgrade in every term regarding its infrastructure, its processes and technologies. In the beginning of this pandemic, it was an AI system that predicted a Wuhan-based coronavirus outbreak, days before the first reports came in. Systems like that will be crucial tools for tracking and predicting outbreaks, with apps already working to show us if we have been in places where a confirmed COVID-19 person was. I believe coming out of this pandemic, we will have multiple apps on our phones to keep us informed about imminent outbreaks and to help us keep safe and away from harm's way. But AI algorithms will help us with resource management too. That's a huge issue in overloaded healthcare systems. For example, the AI system that predicted the Wuhan outbreak accurately forecasted the virus's path for the following weeks too. Forecasting tools like that can help cities like New York prepare for a huge influx of infections before the first patient even walks through the door. And frankly, they shouldn't even have to go to hospital. Highly infectious, but statistically speaking, mostly mild virus like COVID-19 clearly shows how important it is to think about healthcare differently. I've been saying this for a long time. The point of care has to switch from the hospitals to our homes or wherever the patient requires help. This is going to be truer than ever going forward. You shouldn't have to go to a hospital and be exposed unless you actually need hospitalization. It was clearly demonstrated during the lockdown how useful point-of-care devices can be. Otoscopes, digital stethoscopes, portable ECGs and many more devices should swarm the market in the near future, making the doctor-patient visit happen only when unavoidable. What I'm trying to say is that if there is any upside to the struggle that is COVID-19, it's that it points out major flaws in healthcare systems and it will speed up the transition to a more efficient, more modern system. Healthcare will finally come into focus. On the individual level and society, we tend to neglect healthcare and prevention until the pain hits. Now, hopefully, our takeaway will be to invest in healthcare and appreciate and reward our medical professionals, because there is nothing more important to keep our world from falling apart than having a functional healthcare system. Because even in a pre-COVID-19 world, overloaded emergency rooms and the general state of most healthcare systems wore down medical professionals, resulting in a reduced quality of life for the medical community, decreased levels of patient care, and staggering levels of burnout. After we get through this, we can add PTSD to this list, meaning that caregivers will require our help and attention. It's now our time to care for them. We also have to look at the top. This pandemic clearly shows how leaders respond in time of a crisis, and it helps us decide whose hands we want on the wheel. Because for decades now, we have mostly been blessed with ignorance, but now we have a generation-defining crisis, and the only way to prevent the next one is to learn from the current one. We all want things to go back to business as usual, but business as usual is partially what got us here in the first place. Instead of waiting for this to be over, we shall now look at how we can get the most out of it together. Instead of wanting to go back to our old lives, we should all focus on how to create a more resilient and more efficient world. As the British Queen says, we will meet again. But it's up to us to make sure, on that day, the world will be in a better shape than how the coronavirus found it. If you like this video and want to hear more about how digital health helps fight COVID-19, subscribe below.